Welcome back to Medical News Today. It's February 15th, 2026, and we have a packed episode featuring major cancer breakthroughs and a look at how AI is officially changing the doctor's office. But first, we start with a massive review of 23 randomized trials published today that's making waves in the world of cardiology. For years, patients have reported muscle pain, memory issues, and depression as side effects of statins. However, this new data suggests that the vast majority of these symptoms are not actually caused by the drug itself. Researchers found these symptoms occur just as frequently in patients taking a placebo, pointing toward a powerful nocebo effect. If you're on heart meds, this might change how you and your doctor talk about your daily routine. Cancer care, management, and pricing. In cancer news, health experts are shifting the focus from just fighting the disease to managing it more humanely. Today, specialists at the Dana-Farber Cancer Institute highlighted that while chemotherapy remains a primary weapon, side effects like hair loss and fatigue are becoming significantly more manageable through new targeted supportive therapies. Meanwhile, a major update for patients in India. The government has confirmed that all anti-cancer drugs are now regulated under the DPCO 2013. Over 131 formulations now have strict price ceilings, and manufacturers are barred from increasing prices by more than 10% annually. This is a massive win for making life-saving treatments more accessible to millions. The male birth control breakthrough. Is the male pill finally here? Scientists at Michigan State University have just uncovered the molecular switch that powers sperm for their final dash toward an egg. By tracking how sperm use glucose as fuel, the team discovered a way to potentially keep those cells dormant. This breakthrough could finally unlock a reliable, non-hormonal male birth control option that many have been waiting decades for. AI and high-tech medicine. Moving into the Future of Health segment, 2026 is officially the year of digital twins. Surgeons are now using virtual replicas of a patient's heart to rehearse complex valve replacements before the first incision is even made. And it's not just in the OR. New AI-powered diagnostic tools, like the GI Genius, are now being used in routine colonoscopies. This AI scans every frame in real time, helping doctors spot polyps that the human eye might miss, potentially reducing missed cases by up to 50%. Also, keep an eye on your local hospital's ICU. Hospitals are beginning to pilot AI healthcare agents that integrate directly into clinical workflows, helping overstretched staff monitor patients around the clock without the alert fatigue common in older systems. Regional focus. India's healthcare expansion. Turning to India, the Ministry of Health informed Parliament today that the country now has 818 medical colleges, with a record 1.28 lakh MBBS seats. In Jharkhand, citizens will soon have access to local liver and kidney transplant services, reducing the need for travel to other states. However, it's not all smooth sailing. The SCB Medical College in Cuttack is currently facing intense scrutiny following fresh allegations of negligence in their ICU. We'll be tracking that story as the investigation unfolds. Next, a quick health tip for the week. A large-scale study just confirmed that swapping just 1 hour of TV a day for light physical activity can slash your risk of major depression, especially for those in middle age. Quick Bites the Bullet Round. In other news, we've the following. Asterisk discovery of the virus. Hepatitis was suspected to have a viral etiology by the first decade of the 20th century, and by World War II, physicians were giving gamma globulin to mitigate outbreaks. Generalized immune globulin lacks the specificity of hepatitis B-IgG, HBG, administered today to high-risk neonates along with the birth dose of hepatitis B virus, HBV, vaccine. But it helped prevent the disease from spreading in the close quarters common in military settings. On an episode of the period TV series M*A*S*H, set in wartime Korea, the lead character, Hawkeye Pierce, administers intramuscular gamma globulin injections as prophylaxis for hepatitis. The program did not specify A, B, or C, because in the 1950s liver inflammation was classified into just two types: infectious hepatitis, which spreads via the fecal-oral route, and a serum, or bloodborne, form of the illness. The classification changed with the identification of HBV in the 1960s, which occurred in two major steps, each involving a different researcher. While working at the U.S. National Institutes of Health, Baruch Barry Bloomberg discovered a protein in blood that he named Australia antigen in 1963, because initially it turned up only in the serum of an Aboriginal Australian. Bloomberg, who had been interested in what he called geographic medicine, believed this protein to be human, not viral, until it later showed up in the blood of people from various other geographic locations, all of them recipients of multiple transfusions. But it took the second researcher, Alfred Prince, to show that the *Australia antigen was a piece of a virus that spread in the blood. Medscape. *Skipping meals. Did you know opting out of breakfast makes you 4.5 times more likely to be obese? Going without a meal slows down your metabolism, which makes it more probable you'll overeat later on when you're hungry. WebMD. Drink a glass or two of water. 1 or 2 glasses of plain H2O before you eat breakfast may help you lose weight. Water has no calories, but it's satisfying and curbs your appetite, so you may not want to eat such a big breakfast afterward. It also stimulates your metabolism to help you burn calories. WebMD. That's your medical news update for today. Remember to consult a healthcare professional for any medical concerns. Stay informed and stay healthy. Don't forget to like and subscribe for more daily health insights. Disclaimer: use the content after verification.